Welcome again to my channel. My name is Chrysa Vafeiadi. I'm a certified physiotherapist, and today we're going to talk about spondylolisthesis. So usually in our physio clinic, we have lots of patients coming with a diagnosis of spondylolisthesis, and they are all really stressed and they're thinking that they have to go for a surgery, and that this is something really serious going on, and that they shouldn't move at all, and there's nothing to do about it. Where 80 to 85% actually of patients that they are diagnosed with spondylolisthesis, they can be treated conservatively really well. And only the 10 to 15% of patients, they go for surgery. But let's start by explaining what spondylolisthesis is. So spondylolisthesis is a condition where a vertebra slips forward or backward from their position. So this is the vertebra. This is the disc, which is the pillow between the vertebrae. So imagine like one of the vertebrae slips forward or backward, so goes forward or backward. That can result in pain on your back. You may have pain on your legs too. You may have tingling, numbness around your legs and your feet, or you may not. It doesn't mean that if you have spondylolisthesis, you will have leg pain too, but it can be one of the symptoms. Now, we have different pathologies. You have the degenerative one, which is the most common and is age-related. So as we're getting older, there are degenerative changes around the spine, and you may have spondylolisthesis. And most of those ones are addressed conservatively with physiotherapy and medication. You may have the congenital one, which is you may have it from your birth or during the teenage years, and usually is most common to male athletes, and it can result after a constant injury. For example, if you have a football player or if you have a basketball player. We also have the ischemic spondylolisthesis, which is after fracture, and it is really severe, and usually you need a surgery there. So yes, degenerative, congenital one, ischemic one. So those ones are the main categories of spondylolisthesis. And what you can do for it? Well, the conservative treatment is the medication and the physiotherapy. When it comes to the physiotherapy, it's really important to see a specialist physiotherapist that actually addresses spondylolisthesis. And it's really important to do exercises that will stabilize the pelvic region and your core muscles. So you need stability workout, because one of the most common symptoms with spondylolisthesis is the instability that you will have due to the change of the position of the vertebra. And also, except from the exercises, you need the manual therapy, you need TECAR, ergon, so you need the passive treatments to address the fascia and to do a good fascia release, and then the stability workout. And if you need a surgery, you need to visit and to see a neurosurgeon that will be specialized on spondylolisthesis too. Also, spondylolisthesis is most common, unfortunately, to us women, and especially after giving birth or during pregnancy. And also, if you have hysterectomy and you remove everything, then that can be one of the reasons you may have spondylolisthesis. And you may also have changes on your L5-S1, so on your fifth lumbar vertebra and the first sacral vertebra. Either you may born that way, where those two vertebrae are squeezed together, or you may have changes on the lower part of your spine that can result in spondylolisthesis. But as you can see, up to 85% of spondylolisthesis can be addressed conservatively really well. So I hope that if you were stressed before this video, now that the stress is less, and that you can see that there are lots of things that you can do for spondylolisthesis. And as always, if you liked our video, please press like and subscribe to our channel for more.